In commemoration of this year's World Diabetes Day, the International Diabetes Federation is calling on policymakers to increase access to diabetes education to help improve the lives of more than 500 million people living with diabetes worldwide. This year's theme, Access to Diabetes Education, underpins the larger multi-year theme of access to care. iBrandTV speaks with Dr. Ikechukwu Okongu, a medical practitioner, on access to and the need for diabetes education.
This year's World Diabetes Day, the International Diabetes Federation (IDF) is calling on policymakers to increase access to diabetes education to help improve lives of more than 500 million people living with diabetes worldwide. World Diabetes Day provides an opportunity to raise awareness of diabetes as a global public health issue and what needs to be done collectively and individually for better prevention, diagnosis, and management. This year's theme, Access to Diabetes Education, underpins the larger multi-year theme of access to care. Africa's diabetes statistics illustrates the depth of the challenge. 24 million adults are currently living with diabetes, with that number predicted to swell by 129% to 55 million by 2045. Last year, diabetes mellitus took the lives of 416,000 people on the continent and is forecast to become one of the leading causes of death in Africa by 2030. iBrandTV speaks with Dr. Ikechukwu Okongu on access to and need for diabetes education.
The world is getting to that point where education is, absolutely key, especially for developing countries. We have to know there are so many myths around diabetes. We have to educate the populace appropriately well on what the causes of diabetes are, how it can be managed. So I think they are not getting to the point of, we don't need new drugs anymore. We don't need new investigations or new high-tech whatever. What we just need at this point in time is appropriate education to educate the populace, and those who might be suffering from this illness about, the importance of how to make a diagnosis, how to adequately care for yourself, and how to prevent any complications that might arise from diabetes. So I think it's rather key. Generally, education is a problem in Nigeria. I don't know what the stats are, but I know that a lot of Nigerians don't have a reasonable literacy level. So education, not just in diabetes, but in virtually every illness, even as things as little as malaria, education is usually a very big issue. There's the most general myth there is about diabetes is that if you take a lot of sugar, you have diabetes. That's not exactly true. The cause of diabetes is primarily genetic. And so if you have that genetic issue, even if you don't take sugar all your life, you're likely to end up having diabetes. Now, if you take a lot of sugar and you already have that genetic issue, then you're likely to bring it out much earlier. So those who, you can't tell if you have the genetic defect that leads to diabetes. So it's better you cut back on the sugar, but it's not to say that, okay, because you're taking a lot of sugar, you're going to end up with diabetes. As long as you have that genetic defect, you are going to have it. It's just a matter of time. So these are some of the myths that have to start being dispelled, amongst Nigerians.
Importantly, diabetes is the only major non-communicable disease for which the risk of dying early is increasing rather than decreasing. Known risk factors include family history and increasing age, along with modifiable risk factors such as overweight and obesity, sedentary lifestyles, unhealthy diets, smoking, and alcohol abuse. Unfortunately, these modifiable risk factors are on the rise across all countries in the WHO African region. While people living with diabetes need access to ongoing education to understand their condition and carry out the daily self-care essential to staying healthy and avoiding complications, healthcare professionals must know how to detect and diagnose the condition early in order to provide the best possible care. Perpetua Fasami Peter, iBrandTV.